All attendees are in listen-only mode.
Good afternoon or good morning, as the case may be. Welcome everyone to the monthly Strengthening Families Networking webinar for March. My name is Kaylin O'Connor from the Center for the Study of Social Policy, and I'm very happy that so many people are joining us today. Our focus today is on strengthening families and healthy relationship and marriage education. It's a topic we haven't touched on before, and we're very excited that some leadership from the National Network has taken on this topic and is going to share what they've been working on. So our agenda for today, I'll share some updates from CSSP, and Meryl Levine will share some updates from our partners at the National Alliance of Children's Trust and Prevention Funds, and then we will jump into our topic with Professors Ted Futris and Dave Schramm from the University of Georgia Extension and University of Missouri Extension, respectively. So we'll get to them pretty quickly. We're just going to go through our updates from our two co-hosting organizations to get started. Couple of quick announcements about how these webinars work in case you're new to it. This is a monthly webinar. We invite anyone to join us who's using the Protective Factors framework in their work or coordinating strengthening families efforts at a state or local level. As I mentioned, our two organizations jointly convene these webinars and have done for many years. And each month we have a topic or guest speaker, which is either coordinated by CSSP, by the Alliance, or by a volunteer from the network. So if you have a topic you'd like to share related to the Protective Factors framework or how you're implementing it, contact me and we can work out a way to get that onto a webinar. All the recordings and materials from past webinars are posted on the Alliance's Google site. And when you register for the webinar, you also get a follow-up email that will give you a link to the recording through GoToWebinar as well. So there are multiple ways to access the recording later if you want to share it with people who weren't able to join. A couple of quick webinar tips. If you're having trouble with the sound, the two important things. One is to use your audio pin that shows up. I have an arrow there that shows roughly where that would be on your screen, but yours is personalized, so that's what tells us who you are, so that if you want to speak, we're able to unmute you. And if you want to type in a question, and we can see who you are. If you're calling in on the phone, be sure to enter that audio pin. If you're using the computer, it should automatically connect you to your name, and registration information connects to how you are in the webinar. If you're having problems, the number one solution is to hang up and call back in or to switch which mode you're using. So switch to mic and speakers and see if it's clearer that way, or switch to telephone and call in. And if you are having trouble, type into the chat box and Trish or Martha or I will try to help you. Okay, upcoming webinars, we do this the second Thursday of each month. So on April 14th, we're going to talk about trauma and protective factors. This is probably the top request I get from people in the network of sort of how do we integrate these two big important concepts in our field right now, and a lot of people are doing great work on it. So we're going to hear from folks in North Carolina about how they've integrated protective factors into their trauma-informed work. And then we're going to hear from Be Strong Families about trainings that they've developed for parents about living the protective factors as a way to overcome your own ACEs. So that's going to be very exciting. And mark your calendars for the second Thursday, which will be May 12th, June 9th, and July 14th, with topics still to be announced. Okay, there I am. I'm going to share some updates from CSSP now. We have a new resource that was put up on the website last month about making the link between strengthening families and products from the Devereaux Center for Resilient Children. That center is in Florida. They do great work, and we were excited that they reached out to us about wanting to make that connection clear about how their materials and trainings and other resources support families in building the protective factors. So check that out. It's actually available here in the webinar. You can download it from the handouts list. Or also wanted to highlight that on our website, if you go to the practice section, there's an expander header there called Aligning Practice with Strengthening Families, and under that is a list of making the link fact sheets. We've been adding a lot to that lately, so I wanted to point it out. Actually, one of the new additions there is our focus today about relationship and marriage education, but the Devereaux Center is there as a new one. Triple P is also a relatively new one, so I just wanted to make sure that you all know that's there. All of these take that concept of how do these other initiatives, evidence-based programs, practice models align with and support the protective factors. It can be a valuable tool if you're working with folks who are using another model and are a little bit tentative about saying, well, no, we do we do nurturing parenting program. We're not a strengthening families program, but this helps to show how the two align and work together. Oh, there's my list, which you could also see on the previous slide. And then I just wanted to put out a quick call that we are looking for information and resources, basically looking for materials that initiatives are using to communicate about ACEs and toxic stress with parents. And so even if it doesn't have a protective factors twist on it, we're just interested in how people are doing this and what it's looking like, what the messaging is, and how it's going. So if you have any information you can share, you can send it to me at CSSP, along with my colleague Melanie Meisenheimer. You can just send it to me if you don't capture her email address there. And if you're able to send it today, that would be great, because we're writing something up and doing a lot of that work tomorrow. So just if you're able to send something, please do. And again, with the protective factors lens, that will be another topic we'll be talking about in April. So those are all my updates from CSSP, and I'd like to welcome Meryl Levine, a senior consultant with the National Alliance of Children's Trust and Prevention Funds, to share their updates. Hi, Meryl.
Thanks. Hi, Kaylin, and thank you so much. I'm happy to be here today to share some new Alliance developments. And the first I wanted to share with you is that our, that the group of Alliance certified trainers from all across the country is continuing to grow. We now have 460 certified trainers. 38 new trainers were added the first week of March when we did a training of trainers in Fresno County, California. So that's very, very exciting. And if you go to the next slide, registration is now open for our Salt Lake City training of trainers event. And there are still some available training slots, so we hope that people will register if they're interested. All of the information you need about the training, travel, and other key logistic issues can be found at the link on the Alliance website. So we want to make sure that you know where to find that link. And if you go to the next slide, we can show you that there. On the Alliance website, there we have highlighted on this particular slide the actual tab, which is training opportunities, and we have a number of different training events coming up during 2016. So we hope that you will continue to check the Alliance website on an ongoing basis for details. Always feel free. You can always contact Martha Reeder for any specific information that you need. And we hope that you will take the opportunity to find out more. And moving to the next slide, we are also very excited to share with you a new opportunity that's coming up for parents to share their perspectives in 3 key areas: parent partnership strategies, prevention, early intervention strategies, and substance abuse treatment options for parents. The Birth Parent National Network is right now reaching out all across the country to identify parents who may be interested in participating in structured conversations. And we will really do these moderated structured conversations to really gather perspectives from parents around these key areas in order to help us create messages about policies and practices that would strengthen families. And we want to use these messages to share with policymakers, funders, staff, and other key stakeholders. If you know of any parents that may be interested in participating in these structured conversations, we would certainly welcome you connecting with us around that. And if you go to the next slide, we can, it shows you the exact date. And we are right now doing the registration. It's actually active to register for the first set of structured conversations focusing on parent partnership strategy. And so you can see that we have 2 different dates. One is on Tuesday, March 22nd, and that is in the latter part of the day. And then we have another one on Thursday, March 31st. and that's in the earlier part of the day. So we were hoping that we could get as many parents as possible, and we know that people have different schedules, so we tried to open it up as much as possible. So we hope that you will take a look and get parents to participate. And for those that are interested in joining the Birth Parent National Network, here is the link, and we would welcome new organizations as well as parents that are interested in getting involved in policy work to help improve prevention and child welfare systems reform all across the country. So thank you, Caitlin.
Thanks, Meryl. All right, we were pretty quick with our updates today. Anxious to get to our main topic. Ted Futris and Dave Schramm are here to talk to us about strengthening families and relationship and marriage education. So they're going to tell us about what's going on with relationship and marriage education and how it connects to strengthening families. Ted and Dave, what's up? The mic is yours.
Thank you, Caitlin. Wonderful. Thank you so much. Good afternoon, everybody, and we appreciate you joining us here today to learn a little bit more about relationship and marriage education. Dave and I have been working together for several years on a federal-funded project by the Children's Bureau to develop some training resources for child welfare professionals and professionals working with families in the child welfare system, and have been doing training to help educate professionals about what relationship education is and how to integrate it into the services that they provide. So we're very happy to have this opportunity to join you here today to share a little bit about that. Dave, did you want to share anything? Open up?
Oh, just greetings, everybody from Missouri. Ted will talk a little bit, and then I'll talk some, and Ted will wrap up.
Wonderful. So a little bit about us. Hopefully many of you are familiar with Extension. If not, I encourage you to locate your land-grant university in your state and learn more about what Cooperative Extension has to offer. The resources that Extension has to offer varies by state, but most states do have a Family Consumer Science Extension program that provides support around foods, nutrition, financial education, housing education, and human development family life education, and that's where Dave and I really do a lot of our work, is around the family and life education. And we also part of and work with other extension specialists. We're each extension specialist at our respective universities, but we work with other specialists across the country who specialize in relationship education, and they're part of our National Extension Relationship and Marriage Education Network. And so what we do is try to develop resources that can be made available at low to really no cost nationally to folks to help foster programs, promote programs, and resources to strengthen couple relationships. And so there is the website, nerman.org, and we'll share that again as a resource at the end of the webinar. This afternoon, what we hope to accomplish is we want to give you a brief overview of what are those basic elements of healthy couple relationships that professionals can teach in order to facilitate positive parenting, child well-being, clarify what that is and how it differs from counseling, and then Dave will come in and illustrate how these research-informed principles and skills align with the Strengthening Families Protective Factors. And we'll close with sharing with you a few resources that you can check out for more information afterwards. So to hop right into it, why do relationships matter, and particularly couple and co-parenting relationships? And so what we know is that couple co-parenting relationships impact children's safety and well-being. And you'll see here in the chart that there's a strong empirical base showing how we know that parenting impacts children directly. We know that. But there's an equally strong empirical basis for how couple functioning impacts parenting, which then impacts children. And as well, we know that couple functioning directly impacts children in terms of what they observe, and we'll highlight some of that. So that's often something that's missed when doing programming with just parents. We forget, from a family systems perspective, engaging the entire family in programming is critical for sustainable positive change in parenting practices. And I think, many of you who are familiar with the Strengthening Families protective factors understand that connection, but we still find that the need to find ways to strengthen couple and co-parenting skills is critical to that, and we'll talk more about that as we move along. So what is relationship and marriage education? And that's RME for short. And whereas couples struggle, all couples have their ups and downs and difficulties, and some require intensive support, which is more therapeutic and counseling oriented. But also, most couples could benefit from just learning new principles, new skills that help them develop and sustain healthy couple relationships. They don't, like parenting education, we don't want to just work with the parents who are struggling. We want to work with the parents who maybe are doing fine, but could benefit from learning some new skills that could help make their parenting even better than what it is. So we really do take a strength-based approach to relationship education, and our focus isn't just on how do we fix things, it's how do we start with where you are in terms of your strengths and help elevate and focus on skills that you can further enrich, but also you can develop new skills to enhance your relationship. And so here what we'll highlight are what are those core principles and skills important to a healthy couple and co-parenting relationship. And this framework, our model, is based on the National Extension Relationship and Marriage Education model. This is a model that our colleagues in the network worked on several years to develop, and we reviewed the literature to see what does the research say makes the difference in promoting healthy, stable homes for children, but also healthy couple co-parenting relationships. So it's a research-informed model. It's also very theoretically grounded in terms of why do these things matter, how do they connect to each other to influence couples and family stability and child well-being. It is strength-based, and we also want to be very sensitive to cultural differences and variations. So we won't get into all those unique elements, but I will share with you at the end the link to where you can get the full book and publication online for free to read more about these different elements. But it's developmental in focus. We are very process-oriented, so how do we promote change? How do we help couples engage with each other over time? And we want to emphasize that our approach and model here is we take a do no harm approach. In other words, we're not about pushing couples to get married. We're not about pushing parents to become couples. We're not pushing couples to stay together if they're in a unhealthy, violent, high conflict relationship. We're about helping couples strengthen their relationship and to make healthy, informed choices that are good for them and their family. So, and we have much more information on that in our publication that's available online that you can access for free. So what I'll do here is the next few slides, I just want to highlight what those core principles, those 7 core principles and skills are of healthy couple relationships. And this first one is pretty critical. It's that foundation. If you recall on the last slide, we had that model that had choose right there in the middle to really reinforce the centrality of intentionality, conscientious decision-making about one's relationship choices. The importance of commitment and putting in the effort. And all of you, you know, as parent educators, this is similar to what parents also teach children in terms of understanding that choices have consequences, and that and how we help teach our young children to put forth effort, be intentional about their decisions, understand the pros and cons. Well, in relationships, same thing. And sometimes couples forget about putting in the effort needed to make the relationship grow and thrive. And so what we try to do in relationship education is engage the couples in activities that help reinforce intentionality. And our next concept is care for self. Care for self is something that I think is unique to our model. We know from research has established that healthy couple relationships impact health. And when we think of health, a lot of times folks think of nutrition, exercise, physical health, think of emotional health, mental health, but there's also relational health. And while couple relationships impact the quality of one's physical, mental, and emotional health, research also shows that it works the other way as well, that one's physical, emotional, spiritual, sexual wellness impacts the quality of their couple relationship. Eating healthy and exercising regularly critical. In classes, for example, we often talk about, have you ever felt hangry? Where you're angry because you're hungry, and that impacts how you interact with others, impacts how you interact with your kids as well. A lot of these skills we help teach to couples are very transferable to what we teach to kids as well. Regular sleep patterns. If you're tired, it's hard to be attentive and listen to one another. Helping couples focus and notice and appreciate the good things in their life and the strengths in their life, and so take more of that strength-based approach. And finding ways to manage stress in healthy ways. We also work with couples and emphasize the importance of maintaining that intimate knowledge of your partner's world. A lot of times couples think of, when they hear the word intimacy, many times they think of the physical aspects of relationships. But if you think of intimacy as into me, you see. Into me, you see, intimacy. That's seeing inward, seeing your partner's world, understanding what's going on in their life, taking time to express what's going on in your world, and listening to what's going on in your partner's world. When couples feel that connection, the relationship is stronger. Oftentimes couples who struggle, you'll hear couples say, we just don't feel, I just don't seem to know you anymore. And so we help couples, we emphasize in relationship education skills and practices they can do to stay in touch and what's going on in their world, and understand that goals, interests, likes, dislikes evolve over the course of one's life, evolve over the course of a relationship, so regularly staying in touch and keeping in tune to what is going on in the world. We also work with couples in relationship education to help nurture caring, affectionate behaviors. Respect. Aretha Franklin said it best, R-E-S-P-C-T. That's what it means to me. And in relationships, we help couples, learn how to respect each other, show care for each other, focus on their strengths, accept and value differences, show appreciation. There's the power of just the word thank you. Gratitude in a relationship is so powerful that you may be having a tough day, and when somebody sees and recognizes something that you've done and that person says thank you, that makes us feel good. Whether it's in our couple relationship, whether it's at work, whether it's at outside, maybe at the mall, and someone says, "Boy, you really did something there. That was great, wonderful job," or "Thank you for helping out." It makes us feel good. So there's power in gratitude and positivity in a relationship. So working with couples to help them find ways to be nice with each other. Also in relationships, it's so important that couples maintain friendship. The friendship is core to all romantic relationships. We often think of our partners as our best friend, and so part of maintaining that friendship is connecting with each other, making time with each other. A lot of times we hear couples say there's just not enough time, but you can't wait for time. You have to make time. So helping couples find ways to make time, to explore what interests and activities they have, and find ways to share those activities. Also, we work with couples to help them learn how to nurture those positive interactions. It's not just what you say, it's how you say it. And so helping couples send clear, positive messages. and how to be responsive to their partner when they're trying to connect. So do you turn away from your partner when they're expressing interest in trying to connect with you? Do you respond positively? And every time you turn towards your partner, that helps strengthen the relationship. And how to envision, how to see themselves in the future together, how to work towards common goals, and really establish an identity as a couple while not losing their identity of themselves. So we're not suggesting they should just be a we, but they should be an I and a we. Also, as many of you are probably familiar with, a lot, relationship education also is about helping couples manage conflict, and we really emphasize the word manage. Oftentimes we hear folks talk about conflict resolution, and unfortunately there's a lot of times where differences can't be resolved. Sometimes you agree to disagree, and we help couples understand that conflict is normal in a relationship. The presence of conflict doesn't determine the quality of the relationship. It's how couples handle the conflict, how they manage those differences, that determines healthy from unhealthy relationships. So we work with couples to understand how do you start the conversation dictates the tone of that conversation. Do you start off with a shrieking call of your partner's name, which sends chills down their spine? They're going to react in a stressful way. They might get defensive in terms of, do you use a lot of you nevers or you always? It's going to elicit some defensiveness. So how do you start the conversation, but also how do you listen? How do you listen to your partner to understand where they're coming from? And then how do you manage that conflict by taking time outs, breathing, taking breaks so that you can let your body calm down so you can listen and be there for your partner and handle those negative emotions safely, and so it doesn't lead to violence. Very critical also, I think, to parenting, and Dave will share that shortly. And last, we also emphasize in relationship education that just like it takes a village to raise a child, that same village is so important to helping that family, helping that couple. So we emphasize in relationship education the importance of couples connecting with others. We live in a time where we see families so moving around, and sometimes those support networks really thin out. And so we help couples explore who are the positive social networks, positive others in their lives that they can turn to when in times of need of support, where they can seek out also what organizations, resources in their community can they seek out to support their relationship, and what are ways that they can give as well. So it's not just about receiving service, but we emphasize the importance of providing service, because when couples work together to help others, they also are helping their own relationship. And so with that, I'm going to turn it over to Dave to highlight the links between relationship education and strengthening families.
Right. Hey, thanks, Ted. Greetings, everyone. Once again, my name is Dave Schramm here at the University of Missouri. A little bit of background. My research area really falls into relationship education, parenting education. I've been working with our Strengthening Families Missouri team for the past couple of years and taking these protective factors out and helping parents across the state. Also, if you remember back at that map that was first put out, I noticed there was one person in Missouri trained. That's me, so I'm the lone wolf here that's been trained in that program. I was trained by Martha Reeder and company last fall. And so really, I'd like to kind of bridge these two areas. Since I've been trained in the Strengthening Families curriculum, I have background in relationship marriage education. I'll be discussing how relationship marriage education links to the Strengthening Families framework. There's a lot of similarities, and so I hope you'll pay attention and you'll easily see so much of this really crosses over to each other. So First, and importantly, like the Strengthening Families approach, RME is strengths-based. It's research-based. There's decades of research actually in this area, and it's evidence-informed. RME is also it's prevention-oriented, helping relationships go right rather than stepping in when things go wrong. So this is where it differs from therapy and counseling, like Ted mentioned. So RME is really educational in nature. And third, RME focuses not only on decreasing risk factors, but really increasing the protective factors. And I even sometimes go a step further and call them promotive factors that promote and encourage healthy family and child outcomes. And ultimately, our areas really have common goals. Looking at the big picture, the primary goals for both the Strengthening Families and the RME kind of fields are to increase family strengths, enhance child development, reduce child abuse and neglect by strengthening family bonds, strengthening those relationships. So RME simply approaches it from the couple or the co-parenting relationship, which promotes positive parent-child relationships, as Ted discussed with the spillover effect that I'll mention a few times in these next slides. So on the next few slides, we'll take a look at each of the 5 protective factors just briefly and discuss the similarities with RME. So first, parental resilience. RME seeks to empower parents and emphasizes the importance of healthy self-care. As Ted mentioned on those slides, the eating, the exercise, sleep, the stress management, in relationships. And in the NERMM, then, this is care for self. So there's some spillover here. The goal here really is we all know here on this webinar that flourishing individuals who are taking care of themselves are really better parents. They're better couple, better partner, as well as a better parent. It's really this put on your own oxygen mask first concept. Additionally, in RME, there's an emphasis on how relationship choices may impact their own and their children's lives. Again, the spillover effect comes into play. And in RME, we discuss how intentional actions or purposeful, mindful decisions benefit children, and they teach them how to make good choices themselves. With regard to healthy social connections, RME emphasizes positive connections between partners and co-parents, and we discuss what we refer to as a web of social connections and support with friends and family and community. And so in the NERMM model that Ted mentioned, this is the connect concept. So you can see the similarities in these two concepts. Additionally, with RME, we discuss how healthy parent social connections expose children to positive social connections themselves. So children know what healthy connections and supports look like and how to access or draw on them in times of need. So the next one, here I would like to briefly describe how RME touches upon knowledge of parenting and child development. So we don't emphasize parenting skills or discuss child development per se directly with RME, but again, we come back to the spillover effect, the conflict between parents and co-parents, partners, it spills over into the parent-child relationship. So the opposite is actually true as well. When care occurs between parents and partners, it spills over into parent-child relationships. In RME, we also emphasize a positive family environment, which includes parenting and healthy management of differences. So this is the manage concept in the NERMM that Ted discussed. And of course, as has been mentioned, a healthy couple and co-parenting relationship is better for children in numerous ways. We have lots of research in this area supporting that. Okay, when it comes to concrete support in times of need, RME promotes finding and utilizing formalized sources of support in communities, for example, counseling or therapy, or finding resources that can help with domestic violence. And RME promotes positive money management strategies and economic stability, job skills training, those types of things, because we know that money is one of the top stressors in couple relationships. And finally, RME cultivates the social and emotional competence of children. We discuss healthy ways to manage differences, improve positive communication, again, all of which spills over into the parent-child relationships. So it doesn't take mounds of research to know and understand that parents serve as role models for children's interpersonal relationships, including their future romantic relationships, so that the concepts of kindness and sharing, cooperating, using your words to express your feelings, these are all fundamentals for the development of any type of healthy relationship. So again, coming back to the big picture of what these two fields have in common, it really is healthy, stable couple relationships are related to healthy, stable children, which promote healthy, stable relationships in turn for the children. And so I hope that this view that these aren't really seen as separate. Some of the goals are very similar, and we both work with parents. We simply kind of take it up one to the next level and work directly with parents, knowing again the power of the spillover effect of the healthy couple relationships. When that's going well, it's much more likely to have a healthy parent-child relationship. So I think at this point I will turn it back over to Ted.
Great, thank you, Dave. So the information we just provided an overview on is all provided in a new publication that is just being released, I guess, officially today with the launch of this webinar on making the link between strengthening families and relationship and marriage education. That URL is provided there, but also this is provided as a handout. If you look on your webinar panel under handouts, the CSSP-RME-link.pdf is you can click on that and save that file if you want to save yourself time from going to the website. But go to the website, because Caitlin shared earlier there's a lot of other great new publications on there as well, so check out those other resources also. And also, I mentioned earlier, Dave and I worked together on a grant from the Children's Bureau to develop the Healthy Relationship Marriage Education Training. And if you go to hermit.org, you will find on there an overview of that training and some of the background on it. But also, if you click under modules, you will see that we have provided there a video, audio PowerPoint presentation on each of the 7 core principles we just touched on briefly here today. So you can get a lot more information there on the website at no cost. You don't have to do anything, just click and listen. And right below each video, you'll see links to worksheets and tip sheets and resources that you can download, print at no cost. So those are available there, and you can take those with you into home visits or working with parents to help strengthen those different aspects of that we reinforce there in principles and skills of healthy relationships. As well, a new resource that just came out this past year is Elevate. It's an 8-hour curriculum that's based on the Hermit. Actually, the workbook and many materials are utilize the worksheets from Hermit. And it's the same concept, and it's the same 7 core principles. We just renamed them because we wanted to spell Elevate. So, and you can learn much more about that curriculum on the website at nerman.org. And if you click on Elevate, and that curriculum as well is available for you to download for free. You just have to create an account, log in, and you can download everything. Or you can order the curriculum for low cost. It's $66, and you get everything listed there, the whole facilitator manual, CD with all the PowerPoint slides and video clips ready to go, ready to teach. And so check it out. If you're looking for a scripted, structured curriculum to offer to your parents who are in couple relationships, married and unmarried, either way, couples in general. And last, as I mentioned in the beginning, Dave and I are both with Cooperative Extension. We're both extension specialists, and we work in this wonderful system that, unfortunately, a lot of folks say we're one of the best kept secrets, but but that's been too long, and hopefully some of you are very familiar with Extension. For those who aren't, check us out. In addition to the National Extension Relationship Education Network that focuses on couple relationship resources, you can also go to nifa.usda.gov/extension and to locate where the extension system in your state is housed. Is often in each state's land-grant university, but to learn more about who the contact is there, and what resources they have in the other areas, including child development and parenting, nutrition, physical health, financial literacy, as well as healthy home choices.
Great.
And with that, I'm going to turn it over to Kaylin.
Thank you so much. I think that was a really helpful overview. I'm sure some people in our network and on this webinar were already somewhat familiar with parenting education, relationship education, but I think a lot of us have only been peripherally attached to that, and so it's exciting to see more detail about the model you've developed and how you see it connecting with the protective factors. I hope we'll get some questions from the audience. I encourage you, if you're listening and you've got a question, you can either type it in and we will see that pop up, or you can raise your hand and we can unmute you. And don't sit in your office raising your hand literally. There is a button you can push to raise your hand so that we know you'd like to speak. Please go ahead and do that. In the meantime, while we wait for people to type in their questions or compose themselves to raise their hands, I was going to ask if you could elaborate more on how relationship education works when parents are in a co-parenting relationship. Are you aware of programs that are using this model to work with parents who are not in a couple relationship?
So you mean parents who are not romantically involved, but and so are parenting not resident and non-resident parents, correct?
Right.
Yeah. A lot of these same principles apply in terms of how they communicate with each other. Obviously, they won't have the same. They won't really focus on intimacy, but a lot of those skills on managing conflict, communicating with each other, can be just as helpful. But there are curricula available out there that focus on strengthening just co-parenting relationships. Like, for example, we have a colleague at when she was at Michigan State, developed it there. She's at Minnesota now. A great program called Together We Can. That's wonderful. And on the Norman website, we have a link to extension curriculum resources that folks can browse through to check out as well. Dave, any thoughts? Any additional thoughts on your end?
Yeah, I mean, what we oversee, I oversee a program for divorcing and separating parents that we encourage, again, getting along for the sake of the child. And so the name of our program is called Focus on Kids, and that's really, there may not be a romantic relationship, but focusing on your kids instead of maybe some of the differences that you have is actually one of the strongest predictors of child well-being, is the quality of the co-parenting relationship. Secondly, we know, Kaylin, that the single parents are likely not going to be single for long. Most single parents will have a partner at some point, or rotating partners and many partners. So they'll be involved in a romantic relationship. And so many on listening today may think, well, a lot of my parents are single parents. But again, they likely won't be single for long. And so what better place than to educate them with healthy relationship education while they are single? And so there's curricula that talk about picking a partner, a healthy, red flags, what to look for in healthy relationship, because that partner is going to play a potentially large role with the kids. And so the safety, well-being of the child really is related to who that person is bringing around. And so these areas really are much closer aligned than many think.
Yeah, and yeah, to add on to that, when you go to the hermit.org website, you'll see that several of those worksheet activities we have there are actually intended for those who are not in couple relationships, or actually I should say those who are single but in unmarried or newly dating couple relationships, in terms of how to get to know each other, things to get to know. So you'll find that some of those resources can be very helpful. But Dave's right. Being a single parent does not necessarily equate to being single.
Thank you. Very good to know. We've got some questions coming in. One about, actually two questions have come in about how the framework addresses gay and lesbian couples or LGBTQ families and couples, and whether one of the question is phrased as, is this model used and or evaluated with those families and couples?
Sure. So the model we developed is based on years of research that scholars have been doing over the last several decades on what works in couple relationships, heterosexual and gay lesbian relationships, and how couples handle conflict, how couples communicate, how couples build and strengthen intimacy, dedication research. So research is research on couples of all types, and so our model is based on that research. We just took all that research and said, okay, let's organize it into a framework that can help educators who want to do relationship education understand what all that research is saying works and makes a difference. And so the skills we focus on strengthening couple relations regardless of sexual orientation, and skills are skills. How you communicate with each other is how you communicate regardless of whether you're partners of the same sex or opposite sex. And so we focus on those skills, not so much the sexual orientation of the couple.
Thank you. Great answer. I'm glad to hear that. And another question was typed in from Debbie Peterson asking if there are self-assessments involved in the RME model. Are there tools available?
You mean evaluation tools? So each curricula you want to use evaluation tools. If you're teaching a curriculum, ideally you want to use tools that align with that curriculum in terms of assessing its objectives, and so with the Elevate curricula that I shared there on the website, the Elevate curriculum does have evaluation tools that go along with it. But there, like I said, there's a lot of research out there that's been done on various aspects of couple relations, and so there are a lot of scales and measures to assess those different dimensions. We don't own all of those, of course, but I know we have developed some evaluation tools that go with curricula. Dave?
Is she asking about, did I hear self-assessment? Is that what it is? Or is she talking about program assessment? How is that worded?
It was worded as self-assessment, and of course within Strengthening Families we have program self-assessments, but Debbie, if you want to type more, oh, she just did. She wrote clarification, personal or individual self-assessments, like the protective factor self-assessments.
I mean, some of the tools, Ted, you can probably talk more about that with some of the Elevate stuff, but I know some of the tools we have, like finding your strengths, there's strengths, assessments, little tools that we've used really for the individual as people work with people. All right, let's start looking at your strengths. I think this is under Care for Self, is to find and build on their strengths. And so those types of self-assessments, but I'm not sure, Ted, can you think of any others that really are looking at self-assessment?
I'm not familiar with that, no.
Debbie says thank you. I want to invite people to submit further questions, or even, if you want to share experience you've had. Let's see, I see someone has their hand up. It's Maureen, whose hand is often up due to some sort of glitch in our webinar setup. Maureen, I will unmute you if you actually wanted to speak, but you also typed in a question, so I think maybe that's how you wanted to do it. I did see that someone else had been asking for the link to register for next month's webinar, so I'm going to go ahead and type that in the chat box where I hope you can all see it. Okay, I'm having some, well, I'm just going to hit send and see what that looks like. Yes, so that shows up as a GoToMeeting or GoToWebinar link, so you can sign up for the next webinar. You will also see that in the follow-up email that comes out and in the newsletter that you should be on the list for for our next webinar about trauma and protective factors. Let's see if we've got any other questions or folks who want to share their experiences. I'm not seeing any new questions typed in. Dave, I'm wondering if you want to talk about your experience as a trainer for the Bringing the Protective Factors Framework to Life training, and are you bridging these things in the trainings you do, and what that looks like?
Yeah, good question. Yeah, I had a great experience. It was good for me to go down to Little Rock and be trained by Martha and her team. It was great because my exposure, I mean, I went to the Chicago and saw you there, Kaylin, and really kind of getting involved in the strengthening families kind of movement and really trying to dive in to get a better understanding of it. So it was very enlightening to kind of dig a little bit deeper by being trained over those days and being able to incorporate that into the trainings and the work that I do, because again, a lot of spillover into, I use that word a lot, that spillover into each other's areas, because a lot of these are really universal principles that work both ways in healthy relationships, healthy parent-child relationships as well. If I might mention one other thing that came to me as we were talking earlier, there's been some research, some interesting studies that have looked at parenting education. They've had some parents that took parenting education in one study and some that took relationship education, and then some that took both. And as you can imagine, the ones that took both kind of had this added benefit above and beyond just the parenting. The parents benefited in their parenting by taking a relationship education course. So some of these experts in this area have even gone so as far to say that if you're going to teach parenting education, you better teach a relationship education component. Don't leave that aspect out of it, because most parents will be, if they're not already, involved in a couple relationship, and they're so tied, closely together that he even advocates, that they have them both, that you teach them together.
Thank you. We did have another question typed in about whether facilitators need specific certification to use the training toolkits that you mentioned, or whether they can I know you said one was that you could purchase and download, and then people can just use it.
Yeah, the Healthy Relationship Marriage Education Training Toolkit is available online at hrmet.org, and you can access the videos and watch those to get more content background. There's also some fact sheets and tip sheets available to download, print out, and all of those resources are available online at no cost. And the Elevate curriculum, the structured scripted 8-hour curriculum for couples, Elevate, is available online as well.
I would mention, add to that, Ted, that if people are interested in a face-to-face training, that we have done those, that is available, paying for our time and travel to come, but we have actually traveled if people have a group to do trainings in each of us.
Yes. Yeah, we don't, and just FYI folks, so we don't have like scheduled trainings that we do. But if you're in a state and your team is interested in hosting a training, we're happy to work with you to then come in and provide that training. But we would look for state affiliates to coordinate those trainings.
Great. So just to be clear, anyone can use those materials, download or purchase the materials and use them in training, but you're happy to do some face-to-face training if people want to get more familiar with it.
Absolutely.
All right. Do we have any other questions coming in? I know we've got a couple minutes left if we need it. And I just There's one other question. Sylvia's asking, they mentioned the name of a book, but not sure. Was there a book, or was it just these? I can show the slides about the materials again. I know people are curious about them.
Yeah, so the book I referenced was the National Extension Marriage Education Model. So when you go to the NERMN.org website, you can access the model the book, the publication that has chapters describing each of those 7 core principles, connecting back to the literature with references. So if you want to read more about those 7 principles and see the research behind it, you can access that book online. It's a PDF file. You can download it. If you were to purchase Elevate and for $66, you get the kit, and the kit includes a copy of that book in there as well. But you can access it for free online too.
Great. Thank you. One of the great things about Extension is how many materials are available for free for people to put to good use. It's wonderful. All right, well, I'm going to put up our contact information. These are the emails of everyone who spoke today. And I just really want to thank Ted and Dave for taking the time both to do the webinar today, but even more so for writing up the paper that's now on our website, and that really helps to make that link between the work that all of us in the Strengthening Families world are so committed to, and how couple relationships fit in with that, and where RME can play a role. So thank you so much for joining us, and I hope that many of you will join us again in April. And again, Ted and Dave, thank you so much.
Thank you.
Have a great rest of your day, everybody.